All right, so today we're diving into employee wellness programs.
Mhm.
We've got some really interesting stuff to look at. You sent me some marketing material in this really in-depth article. And one thing that really jumped out at me was this idea that wellness programs could actually help with employee retention. I mean, is that really true?
Yeah, it's really interesting. It's becoming a lot more than just like a perk, kind of a nice thing to offer. It's actually becoming a real strategic tool that companies are using.
Okay, so I think maybe we should take a step back for a second. And for anyone who's not really familiar with this, what exactly are these programs? I mean, the marketing stuff explains it pretty simply.
Yeah, they do a good job. Basically, it's just being proactive about employee health. So we're talking about screenings for things like diabetes, high cholesterol, even chronic conditions you might not even know you have. The materials mention things like blood pressure checks, cholesterol tests, that kind of thing. Starting cost is about $150 per employee.
So it's kind of like an annual checkup, but you get it through work.
Yeah, exactly. And the idea is you catch these health issues early before they become like major problems. And obviously that's good for the employee, but it can also save the company money in the long run.
So that's where the whole preventative care aspect comes in.
Yeah.
The article really emphasizes that. But how does that actually translate to cost savings? I mean, how does that work?
Well, think about it this way. If you catch high blood pressure early on, maybe you just need some lifestyle changes or medication. But if you let it go and it leads to heart disease or a stroke, now you're talking about serious medical interventions that are not only expensive, but also disruptive for everyone involved.
And I imagine that all ties into productivity as well. I mean, if your workforce is healthier, they're probably going to be more productive, right?
Absolutely. The article actually cites a bunch of studies showing that people who participate in these programs, they tend to take fewer sick days, and their overall performance at work actually improves.
Okay, but it's not just about the numbers, is it? I mean, I remember reading in the article that these programs can actually improve morale and even employee loyalty.
Oh yeah, that's huge. When companies invest in their employees' well-being, it builds trust and it shows that they actually care about their employees.
Right, it sends a message that they're not just cogs in a machine.
Exactly. And that leads to employees feeling more valued, they're more likely to be engaged in their work, and they're less likely to leave the company.
Which brings us back to that whole retention thing we were talking about earlier.
Right. It all connects. The article mentions companies seeing a significant decrease in turnover after they started these programs.
So it really is a win-win.
Hmm.
Employees are healthier and happier, and companies get a more stable and engaged workforce. Okay, so we've established that there are some pretty compelling potential benefits here. But I have to ask, are there any downsides? I mean, the materials you sent are really positive,
Yeah.
but there's always another side to the story, right?
Oh, absolutely. There are definitely some potential challenges and things you really need to consider.
Like what?
Well, one of the biggest concerns is privacy.
Oh,
I
right.
mean, we're talking about people's health information. That's sensitive stuff.
Yeah, that's a good point.
So companies need to be really careful about how they collect that data, how they store it, who has access to it. They need to make sure they're protecting employee confidentiality.
And I imagine there are probably some legal considerations as well, especially with all the regulations around health information.
Oh, for sure. There are a lot of legal and ethical nuances. And companies need to make sure they're in compliance.
So it's not just as simple as offering a few health screenings and calling it a day. There's actually a lot more to think about.
Yeah, you really need to make sure that these programs are implemented effectively and responsibly.
Okay, so we've talked about the what and the why of these programs, but how do they actually work in practice? What does implementation look like?
Well, one of the key things is accessibility.
Okay,
You need to make sure that all employees can participate.
so not just the people who work in the office,
Exactly. You've got to think about remote workers too, people who work from home or from different locations.
which is a lot of people these days.
Yeah, it's a whole new world of work. So you might need to offer flexible scheduling options, virtual consultations, maybe even mobile health units that can travel to different locations.
And I imagine the types of resources offered will vary quite a bit.
Oh, definitely. It depends on the company and the needs of their employees. Some programs might focus on physical health, offering things like gym memberships, fitness classes, or nutritional counseling. Others might prioritize mental well-being, providing access to therapists or stress management workshops.
It's about finding the right fit for each company.
Exactly.
So let's say a company decides to go all in on a wellness program. What are some of the first steps they should take?
Well, the first thing is a needs assessment.
Okay.
You need to understand the health risks and concerns of your workforce. What are the biggest issues they're facing? Are there high rates of stress or burnout? Are there certain chronic conditions that are common in your industry?
So it's about getting a baseline.
Exactly. That information will help you design a program that actually addresses the specific needs of your employees.
So it's not a one-size-fits-all approach.
Nope, not at all. It's got to be tailored to the specific population you're serving.
All right, so let's say we've got a company that's done their needs assessment, they've designed a program, and they're ready to roll it out. What are some key things they should keep in mind to make sure it's a success?
Well, communication is
Yeah.
key.
Okay.
You need to be really clear with your employees about the program. What are the benefits? How can they participate? What are their options? You also need to address any concerns they might have.
Because if people don't understand the program or they're hesitant to participate, it's not going to be very effective.
Exactly. And it's not just about explaining the program. You need to create a culture of support and encouragement.
What do you mean by that?
It's about providing resources and information, maybe offering some incentives for participation,
Yeah.
and celebrating successes along the way.
So it's about making people feel good about participating.
Exactly.
Yeah.
And that's where leadership comes in. When leaders actively participate in the program and they champion its benefits, it sends a really powerful message to the rest of the workforce.
It shows that they actually believe in it.
Yeah, it shows that they're truly committed to employee well-being.
So it's about walking the walk, not just talking the talk.
Exactly. And by doing that, companies can create this positive cycle where employee well-being and business success go hand in hand.
Okay, so we've talked a lot about the how-to of these programs, but I want to circle back to something you mentioned earlier, data privacy, especially when we're dealing with health information. It seems like there's a lot of potential for things to go wrong.
Oh, yeah, that's a huge concern. Companies really need to be careful here.
So no sneaky data collection happening in the background.
Absolutely not. Transparency is key. Employees need to know exactly what data is being collected, how it's going to be used, and who has access to it.
And I imagine there's some legal requirements around this as well.
Oh, yeah, definitely. There are strict laws about health information, things like IPA in the US. Companies need to make sure they're in compliance.
Okay, so compliance is crucial. But beyond that, what are some best practices for protecting data privacy?
Well, one important step is to de-identify the data whenever possible.
Okay, what does that mean?
Basically, you strip away any personally identifiable information, things like names or social security numbers, so you can still analyze the data, but you're not compromising anyone's privacy.
So you're essentially anonymizing the data,
Exactly.
and that way you can still use it to track the program's effectiveness.
Right. And, another important thing is to only collect the data that's absolutely necessary. Don't go on a fishing expedition.
Right, just get what you need and nothing more.
Exactly.
Okay, what about data security? How can companies ensure that this information is protected? I mean, we hear about data breaches all the time.
Yeah, data security is paramount. You need robust security measures in place, things like encryption firewalls, access controls. You also need a plan for what to do if a breach does occur.
So it's about being proactive and reactive.
Exactly. You got to have multiple layers of protection.
And it's not just about technology, right?
Right. You need to train your employees on data privacy best practices. Create a culture of security awareness.
So it's a combination of tech and human factors.
Absolutely. It's a shared responsibility.
Okay, so we've covered a lot of ground here. The benefits, the challenges, the implementation, the data privacy. But before we wrap things up, I want to go back to something that really struck me in the article. This idea that these programs can have a ripple effect beyond the workplace.
Oh, yeah, that's a really interesting point.
So it's not just about individual employees. It's about creating a culture of health that can have a wider societal impact.
Exactly. Imagine if employee wellness programs became the norm and workplaces across the country were actively promoting healthy habits.
What kind of impact could that have on our healthcare system?
Well, we're catching health issues earlier
Yeah.
and preventing chronic diseases. It could potentially lead to lower healthcare costs and a shift towards a more preventative approach to healthcare.
So instead of just treating illnesses after they happen, we're focusing on preventing them in the first place.
Exactly. And that could have a huge impact on the health and well-being of our society.
Wow, that's a pretty powerful vision. So these programs aren't just about boosting productivity or reducing sick days. They could actually be a driving force for positive change on a much larger scale.
That's right. And while there are definitely challenges, the potential benefits are undeniable.
It's definitely something worth exploring further. So for our listeners out there who are intrigued by this topic,
Yeah.
What are some key takeaways they should keep in mind?
Well, first and foremost, think about the specific needs of your workforce. What are the health challenges they're facing? How can a wellness program help address those challenges?
It's not a one-size-fits-all approach.
Exactly. And you need to carefully consider the legal and ethical implications, especially around data privacy.
Transparency and security are paramount.
Absolutely. And finally, I'd encourage them to think big. Don't just focus on the immediate benefits. Think about the potential ripple effects. How can these programs impact the wider community?
It's about seeing these programs as more than just a perk or a cost-saving measure. They can be a catalyst for positive change.
That's a great way to put it, and I think that's what makes this topic so fascinating.
Well said. Thanks for joining us on this deep dive into employee wellness programs. It's been a truly enlightening conversation.
It's been my pleasure.
It's a lot to take in, isn't it?
Yeah, there's definitely a lot to consider.
So for our listener who's thinking, okay, this all sounds great, but where do I even begin? What's a good first step?
Honestly, I'd say start by asking your employees what they need.
So simple yet so brilliant.
Instead of trying to come up with some program and impose it from the top down, just ask your people. A quick survey, maybe a couple focus groups. You'd be surprised what you learn.
And that way you can make sure the program actually addresses their concerns.
Exactly. You're creating something based on their needs, not just what management thinks is important.
Which actually reminds me, we talked earlier about leadership buy-in. How important is that for these programs to really succeed?
Oh, it's essential. If the leadership team isn't fully on board, if they're not actively participating in promoting the program, it sends a message that it's not really a priority.
Yeah, it's all about walking the walk, really.
Exactly. Actions speak louder than words. But when leaders are visibly engaged, it creates this ripple effect throughout the organization.
It shows that they really believe in it.
Exactly. It shows that well-being is a core value. And it gives employees permission to prioritize their own health.
Okay, so let's fast forward a bit. Let's say a company has done their homework, they've implemented a good program, leadership is on board. How do they know if it's actually working? What are some signs to look for?
Well, obviously, you can track things like participation rates, get feedback from employees, but you might also start to see a shift in the overall culture of the workplace.
Who so?
Well, maybe people start taking more breaks, stretching, going for walks. Maybe they're bringing in healthier lunches. There might be a greater sense of camaraderie.
It's like a vibe shift.
Yeah, exactly. And over time, you might start to see more concrete results, like a decrease in absenteeism or lower healthcare costs.
But those things take time.
Absolutely. It's a marathon, not a sprint.
Okay, so for our listener who's feeling inspired, but maybe a little overwhelmed by all this information, what's one piece of advice you would give them?
Don't try to do everything at once. Start small. Focus on one or two key areas and build from there. It's a journey.
It's about progress, not perfection.
Exactly. And the best part is, it's a win-win for everyone. When employees feel supported and valued, they're more engaged and productive. And companies benefit from a healthier, happier workforce.
It's a beautiful cycle.
It really is.
Well, on that note, I think it's time to wrap up our deep dive. It's been an amazing conversation.
I've really enjoyed it.
And to our listener, we hope this has given you some food for thought and maybe even some inspiration to create a workplace where well-being is a top priority. Until next time, keep exploring, keep asking questions, and keep striving to build a better world of